This video is intended to go along with Chapter 5 from your textbook and introduce the issues surrounding sampling and probability, which is the foundation for inferential statistics. So, to begin with, we'd like to talk a little bit about samples and their populations, and why statisticians would use samples to begin with anyway. They're kind of stingy. They don't want to have to go out and do all that work and collect data on an entire population. And so really what we're talking about is how do we use samples to make decisions about the populations they represent? So it's kind of a balancing act. There are risks and rewards involved when we're talking about sampling and why statisticians choose to do that. Now the risks of sampling include things like the sample might not actually represent the larger population. The smaller your sample size, the more likely this is to be true, because what you end up is having perhaps a few individuals in a small sample that are actually pretty extreme values of, or extreme scores that might not really represent the typical score. Another risk is that we might not know that the sample is misleading. We might think that our sample actually represents the population that we would like to say something about. And if we don't know that the sample is misleading, we might actually reach conclusions that are inaccurate about the differences that we find between this population and perhaps another one. And so when we find these inaccurate conclusions, we might actually make decisions about our hypotheses that are based on bad information. So that's kind of the drawbacks of using sampling. But there's a lot of rewards as well. The first is that the sample can represent this larger population, which is really great because you don't want to have to go out and perhaps test every single college student to find out whether or not a particular characteristic is true. You'd rather have to use a sample. We can, by using sampling and getting replication, which is when we sample multiple times, run the same sorts of analyses, ask the same questions, and we find the same results, that can increase our confidence in the findings that we have. Another advantage is that it's economical to use sampling because we can get pretty accurate conclusions and it doesn't cost us a whole lot. We don't have to invest a lot of time and a lot of money in collecting data. And another reward is that we remain open-minded because we do know that samples can mislead us. So we're cautious about the generalizations that we make, and that's part of the reason why in the scientific method we use replication. And finally, because we are skeptical and we realize the limitations of sampling, we can make wiser decisions based on the evidence that we have available. So I'd like to talk a little bit about random samples. Now remember that this is a little bit different from random assignment. Random samples has to do with how we select our data. And in a random sample, every member of the population has an equal chance of being selected for a particular study. And one of the things that's kind of a problem is that we almost never use random samples in the social sciences. And that's because it's really hard to access the entire population from which to select your sample. So if you were running a study on first-year students and how they fare during their first semester in college, it would be really hard to get the population of all first-year students, or even just to get a list of all first-year students from all of the colleges and universities in North America, and then randomly sample from them. So generally speaking, we can't do that. Random samples almost never happen. Just a side note is that a random assignment is what you use in order to have a true experiment. And random assignment happens when you have already selected your sample and then each person in that sample has an equal chance of being assigned to one of the conditions in your experiment, one of the levels of the independent variable. So if you had two different kinds of study group interventions, for example, and you had a sample of first-year students already, then you randomly assigned them to participate in a online study group versus a face-to-face study group. And so every person in that sample has the same likelihood of being put in the two different levels of that independent variable, the online or the face-to-face version of the study group. So that's just the distinction between random samples and random assignment. So random samples are how we get the participants for our study. So there's a number of different ways that you can use random sampling, different variations of sampling. So you might see, for example, a variation on random sampling called cluster sampling, where you decide, okay, I'm going to randomly select students from 3 different elementary schools. And so within each of those elementary schools, who might differ, say, on the tax base for the programs and the method of teaching, then you can randomly select students within that school. And that would be cluster sampling. Another type is stratified sampling. So you might use this where you want to assure that an underrepresented group has sufficient numbers in order for you to say something about how they function with respect to how another group functions. So maybe you want to make sure you have enough English language learning students in your study, and then native English speakers in your study as well. So you'd want to randomly select within those 2 different strata, or the non-English speaking and the English speaking strata. The final one is really not random sampling at all. It's called a convenience sample. So a convenience sample might be, hey, I'm teaching Gen Psych. Let's see if I can recruit some students from my Gen Psych class. And then people volunteer or don't volunteer. So convenience sampling really has to do with, I'm going to use whatever's available to me, and I'm not going to really worry about getting a completely representative sample. Or I might just say, I'm just going to study Goshen College students because I have access to those students. So why might you use these instead of full random sampling? Well, sometimes, like I said, you might want to assure that an underrepresented group is available, or you might have some characteristics that you can't randomize that you'd like to at least have some idea of how that works. So like in the school example with cluster sampling or convenience sampling, maybe you can't spend a lot of time trying to get your participants, and so you use what's readily available. Knowing that when you replicate your study, if you get a slightly different sample, or you replicate it in another institution, for example, then that strengthens your findings. Okay, so this is the main limitation of using convenience sampling, is that you can't really generalize your findings beyond the sample that you have. So generalizability, and this will come up many times over the course of the semester, generalizability is our ability to apply findings from one sample or in one context to other samples and other contexts. It's essentially a way of getting at external validity. Now, if you have limitations to generalizability because you don't have a random sample, you have a convenience sample, then you can actually improve that replication. Perhaps you have a friend who's doing research at another school and they can collect data at their school as well. So maybe it's a larger state school, and we can see whether or not the relationships among variables that we find at Goshen are the same or they're different. And so if we find the same findings, then we have more confidence in our ability to generalize beyond the particular sample that we started with. So that's part of the reason why we use replication in our studies in terms of the scientific method. Another thing that you probably have seen quite a bit is, especially if you've ever turned on the TV late at night, is testimonials, right? This is a biased sample. People who give testimonials generally are people who've had good results with a particular product, and their results are extremely outstanding. They're very vivid. You've got these people saying, I use blah, blah, blah exercise program, and I lost 60 pounds in 6 months, or something like that. And so people are, wow, if they can do that, why can't I? Well, these are very vivid and extreme cases, and so they're not likely to be actually representing the typical person who used a particular product. So a testimonial is a volunteer sample of a single person, and the generalizability for that is not good. Oh, so now that we've talked about sampling, I want to come back to random assignment again, because I really want to make sure that you understand the distinction between the two. Random selection has to do with how we get our sample, and random assignment has to do with what we do with that sample then when we're conducting our experiment. So in random assignment, again, all participants have an equal chance of being assigned to any level of the independent variable. And so you might say, okay, well, I have 3 different levels of how much caffeine I'm going to give people, and then I want to measure how long it takes for them to fall asleep at night. So I will randomly assign my sample. They have an equal chance of being assigned to no coffee, 1 cup of coffee, and 3 cups of coffee, for example. And so that's random assignment, what you do with your sample. Now, random selection is almost never used because we don't have access to that full population. However, random assignment is very frequently used, especially when we want to have a true experiment, which means that we are trying to wipe out any differences among people or across groups that has to do with individual variability. So if we use random assignment, then we're likely to have equivalent groups in each of those levels, especially as our sample size gets large. So it allows us to conduct a true experiment. Here's another example of what's called a randomized block design. So we come up with, as you see here in the first level, we find blocks based on patient treatment history. So if we have individuals who have had only outpatient treatment, that would be our first block. And then we have individuals who've had both outpatient and inpatient treatment for a particular disorder. So that would be our second block, because we would expect perhaps that the severity of whatever disorder they're dealing with, if they have to have inpatient treatment, is higher. And so we might expect that treatments would function differently depending upon whether somebody is in an outpatient group or they're in an inpatient group. So you'll identify those 2 blocks of interest, and then within each of those blocks, you randomly assign them to the different treatment groups. And there are 3. It's the same treatment, but now we've made sure that outpatient people, you can't randomly assign people to be an inpatient or an outpatient person because there are other factors that contribute to that. So we then use those 2 groups that we can't randomly assign, and within those groups we can randomly assign them to treatment, and we can make a comparison then. So that's a randomized block design. So here, I'd like you to check your learning. You might want to pause this and read through these questions and decide whether or not you believe random assignment could have been used or not for each of the following scenarios. Okay, so I'm going to go ahead and talk through these. The first is a health psychologist examined whether post-op recovery time was less among patients who received counseling prior to surgery than those who did not. Now, if we want to talk about random assignment here, we could randomly assign our groups of people who are going to undergo surgery to one condition or another. So the first one, yes, it could have been used. The second one here, whether people diagnosed with personality disorder were more likely to miss therapy appointments than were people without a diagnosed personality disorder. Well, we can't randomly assign people, especially to something like a personality disorder. You can't make somebody have a personality disorder or not. You can't make somebody be depressed or not. Aside from the ethical issues, it would be really hard to induce those things. And so random assignment in the second case was not used. And that's what's known as a quasi-experiment. So we can't actually do a true experiment here. All right, so that is an introduction to sampling and why we use the particular samples we do. The next video will help you understand more about how we use then samples to say something about population.